The affidavit of posting was posted accurately. Marietta is excused today as far as a roll call. Let's rise and say the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Right. As far as the consent agenda, I need a motion and a second to,
Motion.
Second.
okay,
Or third.
all those in favor? Aye. Right, opposed? No, okay. So, we're gonna switch the items today as far as action items we'll put first and the discussion items put second, okay? So the first action item we have is the use of the American Rescue Plan Act funds, the behavioral health grants to local nonprofits. I need a motion and a second to
Moved.
open that discussion.
Second.
All right, all those in favor?
Aye.
Opposed? All right. Julie, if you will give us that action item. A.
Well, just voted on it.
We're done. We
You
just
accepted-
voted on.
you Voted and accepted them.
Yeah, you didn't ask for discussion. But-
Oops. Oh, the voting part.
You, yeah, yeah.
Okay.
So, I mean, unless you want Julie to touch on anything, you guys have already accepted that.
Just A.
Just. A.
Okay.
So you can move on to the next.
Okay.
I'm happy to discuss if you want to ask any questions.
Did they already voted?
So it doesn't matter.
Yeah.
Okay.
Sorry, I
That's okay, don't worry.
get the voting too excited here. So we're gonna do this differently with item B. The use of the American Rescue Plan Act funds for the Samaritan incentives.
Oh, okay.
Okay. Oh, no, yes,
Okay, so I'll do the motion.
all right.
Second.
Okay, and second by Supervisor.
Discussion.
Yes, now for the discussion.
There we go.
Aha, and we don't have Julie. All right, thank you.
So the committee report kind of lays out what we're looking for. This is just following the procedure we've been following with all of what we called the ARPA funds. So if there's any questions on any of the specific items, I can address those. I will note that the tuition reimbursement portion on here is complete. So that number is a final number. The other two items are still in process, and I believe for pickup pay, there's going to be a modification coming forward. So that estimate may change, but I haven't gotten new information on that yet. As I look at Matt Perno. So, but if there are questions, I will try to answer those for you.
So this is just the wage incentives for. Simulation.
Yes, for the pickup pay, correct.
Right, no more discussion. All those in favor? Aye. Opposed? Right, that passes. Item action C is the Samaritan 2020 account receivables, the write-offs. If I could have a first and a right,
Second.
all right, and discussion. Or the write-offs. Aha,
Hi,
hi.
my name is Trisha Holbrook. I'm the business office manager at Samaritan. I'm the one who prepared the write-offs.
Okay,
For today, I laid it all out by payer source. If they were making payments, if we had tried to give you some notes without the whole case. So if you have any questions, I'd be happy to answer those.
any questions? I just, I have a comment and then a question. And when I looked at the history, over the years, when did it start here? That graph was really helpful in 2015. And compared to now, you know, the write-offs in 2015, close to $500,000 and now 60,000.
Right.
So that's commendable. That's incredibly well done. What do you attribute that to?
I started with the county in 2014 and I was brought in to start kind of shaking the money trees and getting the money in. We worked with the attorney on a lot of cases. They just didn't pursue this. We decided we'd start taking payment plans. Some people can only pay us $5 a month and we are accepting of that. And that really makes them work with us and get that money in. A little patience goes a long way with people on limited funds. We've constantly are looking at how we collect money. We've changed our practice when people come into the building to make sure we're having those conversations up front. We work with them to apply for Medicaid and do that timely because it's a very long process to get everything together and have the right information. So we try and be more proactive, which then helps us so we're not sitting, waiting for people to get these things done. We assist them in getting them done, which makes it much simpler and thus doesn't add up a bunch of debt that we're not going to collect.
Sure. And I know on this graph, it doesn't show the percentages of the uncollectibles from like Medicaid or from United Healthcare or Optum, or it doesn't specify, but can you give a roundabout like?
This is the first time I've had to write off anything from United Healthcare. We were newer with them. I think we're in our 4th year now. We were working with a account rep on some of these more challenging cases, but when you start a new contract, you're going to have hiccups. The representative kind of worked with me over a course of 1.5 years, then he left. So now I was kind of on my own with the appealing process and trying to get it done. And eventually they just were out there too long and we couldn't get them corrected in time. So that's, another thing you live and learn and change make sure we're a little more on that in the beginning, even though the rep said, oh, it'll be fine. No, not fine. So yeah, typically our write-offs will be your patient liability, which is the money people owe you when they're on Medicaid based on their income. A lot of times when you apply for Medicaid, you're over assets so that you have to pay that liability, but you don't have that money to pay. So they're always kind of playing catch up. And then those people pass away and there's no more funds. Our private pay is mostly patient liability that didn't get paid or someone didn't qualify for that month and was making payments and passed away. But I would say probably 80% of our write-offs come from people who pass away.
That's helpful to know. Thank you.
Mhm.
Any other thoughts or questions? Okay, thank you.
You're welcome.
Tricia. So we'll vote on that as far as approving the Samaritan account receivables write-offs. All those in favor?
Aye.
Opposed? Right, that passes. Item D, the 2022 ordinance, we're going to amend the section 8.6 relating to the food safety and recreational licensing. This is just changing the word descriptions in the. Kim is here.
Hi, I'm Kim Beekler, the Director of the Health Department, for those of you that haven't met me. This is a pretty simple request from our department, but we are hoping to change just some of the wording in our public health ordinance, which is mirrored in Ozaukee and Washington counties. So section 8-6 was or is currently titled Food Safety and Recreational Licensing. That's the title of our program for our restaurant and hotel licensing. It was changed by DATCAP at the state level to officially be called Food and Recreational Safety. So we're looking to make that change reflected in our public health ordinance. And then further down in section H under fees, there's one additional minor edit that we're hoping to make. And that is the change from the wording of temporary fees to transient retail food serving meals. That's just one of the ways that they label the different fee structures for the program.
You.
Just curious, I remember at Glacier Hills, we had a little problem, I think, with food service and how that's done there. Was this part of that where we couldn't quite get a license because there?
It's
was a-
part of that program. Yeah.
I
Yeah.
thought I recognized,
Yeah, we do annual licensing inspections.
that makes sense.
Okay,
Right.
so could I have a first and a
So moved.
motion and a second?
Seconded.
All right. All those in favor?
Aye.
Aye.
Aye. All right, thanks, Kim. That takes care of the action items. I just want to be absolutely sure, yes. We'll move up to the discussion items. And first on deck, we have aging the ABRC. We have Tammy on her quarterly report.
Hello, good evening. I'm Tammy Anderson, the Director at the Aging and Disability Resource Center. The first initiative that I'll be discussing is to reduce social isolation in Washington County. We're very much on track with that and actually way ahead of the game. Back in November 13th through the 19th was Social Isolation Awareness Week. So we did do a bunch of postings, a posting every day, just some statistics and graphics information. I'm part of the Wisconsin Coalition on Social Isolation and Loneliness. They provide a monthly webinar, kind of a discussion of ideas, lots of informational webinars, lots of conferences. There's a big movement in this area right now. And then we currently have 2 separate intergenerational programs up and running, one at Addison Elementary School in Slinger. That one has 3 participants at this time. And then we just finished up our second session of a technology class. So we have 2 Kewaskum high school students that are teaching, it's been primarily older adults, how to use smartphones and tablets. And that has been extremely well received. I have a waiting list for the 3rd class, which will likely start in spring. Winter isn't usually a good time to hold classes with the population that we work with. And then for those of you that follow the social media through the county, we just posted a story that Fox 6 News did regarding that program at Kewaskum High School. So check that out. It's very, very well done. And then the second initiative, actually called Michael in the county clerk's office today. I'm not sure if this printed incorrectly because there is no wording, but the initiative is in regards to providing additional options to access food through our senior dining program. And we are working with the state right now to look into the feasibility of having a restaurant meal site. So we have 7 sites throughout the county in which we serve meals at the site and then deliver to homebound individuals as well. And we would like to explore the possibility of a restaurant site, having people come to a restaurant. You kind of contract with the restaurant, serve your meals out of there. It usually increases the amount of participants, that sort of thing. We were due to meet with the state, myself and our nutrition supervisor in my department last week, but I was dying of the influenza A, so that got canceled and we're doing that in January. So we're gonna go check out another site in Dane County and kind of talk to them about how that goes, what the options are, and we'll move forward with that, but we are on track with that initiative as well. Any questions?
Just a comment about having been at your meeting, the interaction between the technology and the young people and the older adults, that was fascinating to hear. And
Yeah, it's really a neat
it's
program.
exciting to hear that there's a waiting list, and
Yeah.
hopefully you can get some more young people involved too. So
Yeah, my goal is to start reaching out to some other high schools in the county. I do have a contact at Slinger High School and looking to also reach out to Hartford and Germantown High School and then bring those ladies along from Kewaskum High School to talk about the success of it and how they implemented and that sort of thing. So
Definitely a
we're hoping
win-win.
it will grow.
Yes.
Yeah.
Thanks, Sammy.
Yeah, you're welcome. Thank you.
Hey, the Veterans Quarterly Report. Hi, Kurt.
Hi there.
Welcome.
Great, I don't have to move the mic this time. So we're kind of where we've been. I suppose I'm supposed to introduce myself. I'm Kurt Rush. I'm the Veteran Service Officer. And our update this month is kind of a status quo. Data collection slowed down because of the time of year, the threat of snow and the fact that people don't want to go out in the cold and mark grave sites, but we're coming along. We've got about a third of all the data collected so far. I think it's going to be a bit of a trudge to get the rest of the data, but I'm working actively on getting volunteers, mostly from the veteran community and the various communities that we're still looking for cemetery data for, to kind of gather groups and go out and do this process. So it's just a time-consuming process. I hope we're still on track for late spring, but I think in the next review, I'll be able to give you an update on where we're at, if it's going to take a little bit longer. Any questions? Nope.
Thank you.
Okay, thanks.
All right, next we have item C, the Human Service Administration Quarterly Report. Lee and Anita.
Hi,
Hi.
I'm Anita Olson. I'm the billing supervisor for Human Services. And the initiative my department is working on is we're trying to create a efficient children and families billing system to make sure we're maximizing the revenues that are due to Human Services for specifically the court ordered supervision charges that the parents are responsible for, some shelter expenses, and then the children's the children's long-term parental fees, sorry. So we're on target. In August, we were looking at different systems. We opted for our current EHR system that we're utilizing, and we're currently finalizing the workflow process. We have some meetings scheduled in December. We just began testing in the environment, making sure that our charges and payments are aligning properly. And then once we know that's working properly, then we'll work with IT to make sure that our invoices are carrying the history on the invoices when we print them and send them out monthly. So we're excited because we have one system to, everything will be localized in one system. So.
Questions?
Thank you.
Thank you. Item D on the agenda, Human Services behavior. Oh, I'm sorry. Yeah, we have the other side of that. Okay, sorry, Lee.
Hello, I'm Lee Sanderson, the Health and Human Services Office Manager. I reported back in August on my initiative to improve our external provider billing. I don't remember who all was here at that time, but that was just an initiative to work with our external providers that provide our comprehensive community program services to our clients, our mental health clients. So our initiative, the first phase is to identify some opportunities and some bottlenecks that would help us improve the efficiencies. And the second phase is to maybe look at an automated system to help with that process. So that's kind of what we're doing right now is we've completed the mapping, we've completed the master workflow. So now we're at the target level of identifying the bottlenecks and the opportunities that we need to kind of focus on. So we're on target for that. And so in doing so, we've identified that we have to work with some other departments to kind of move forward with this initiative. And so anytime you do that, you're kind of can hold things up when you're working with multiple departments. So that's kind of where we're at right now with that. We also want to be careful as we're going through and evaluating during the research and development phase so that we're purposeful and thoughtful in the decisions that we make. So right now, I'm in the process of getting those bottlenecks and all that together so we kind of can move forward with that. We want to be able to make good decisions during the process as well. So just taking our time and making sure we're covering everything. We do have a meeting that we're going to be scheduling with the behavioral health managers and then Sandy Hoford, our deputy director. And we're going to talk about next steps. We're also going to look at the initiative itself again to make sure that we're going in the right direction with that. So that's kind of where we're at right now. So if you have any questions?
Thanks.
Okay.
Lee. Right, now we can move on. Human Services Behavioral Health, Doug? Hi, Doug.
I'm Doug Bryan, the Behavioral Health Division Manager. We have a few initiatives that we're gonna get updated on. The first one was to expand mental health services for youth, and we had two different goals for that, which was family-centered therapy. That is on track. We hired our third staff for that, so we're fully staffed now as of the 1st of November. They all have ongoing cases. They participate in a weekly clinical call with our consultant in North Carolina, and there's also a monthly administrative call that I'm a part of as well. So that's on track and it continues to go well. It's very early, but we're excited about that program. The other one is parent-child interaction therapy. We're actually ahead of schedule on that. Treatment actually began this quarter with a couple of families, and that continues to go well. The training for that goes hand in hand with the treatment. So it's a parallel process, and they do a lot of consulting with our trainers while they do the treatment at the same time. So that's going well, and we have 4 cases in that right now. The next initiative was to expand crisis response in Washington County. This was our co-responder model. We're on track with that. We have vacant positions that, or at least one that we can reallocate to that without the referendum going through. We went to a conference, Julie and I and my crisis supervisor went to a conference in November on that, as this is becoming a more common practice around the country. So that was very helpful. We learned a lot of good things. We learned a lot of things we didn't want to do, and some things that we need to do, some training things we need to focus on. So far we're on track. The job description's done, policy and procedures are in place. We just have to launch, and we hope to do that as soon as we can have staff to launch that early next year.
So Doug, I just have a question about what you found at the meeting to be, if there's a generalized model that they're following, kind of the soft without being in uniform and the social worker being in the car or getting called or what?
So it runs the gamut.
Okay.
A lot of jurisdictions have a social worker embedded in the police department, but not necessarily with patrol. They're available to go out with that, go and meet them if they're on scene and they need assistance. That's not the model we're looking for. We want to do an embedded, co-responder model. The ones that do that do respond in an unmarked, police car. The officer is in plain clothes, but they do have their utility or their duty belts on. The social workers have to be trained in basic radio, they call them 10 codes. One of the things we learned, which is something you would easily overlook, was how to put on a ballistic vest, because it's not something people typically do. So we've learned some of those little things. So the models are all over the road. The model we're doing is not as common as some of the other models, but some of them have been around for a long time. And so they've just done what works for their community. The other piece about that, there was some data presentation too, which was interesting because some of the data points that they were measuring was, did law enforcement find it helpful? And it was overwhelmingly positive from law enforcement. So that was encouraging to see, because I think as a mental health professional, I would think that law enforcement might feel like we're in the way. And that was not the general consensus. So that was encouraging for us too. So we're in the process of trying to identify some of those data, those metrics that we want to start measuring as soon as we launch. So
So would there be, as a follow-up question, would there be some kind of training involved with the social workers, like even at the gun range or in the, just the 10 codes as you talked about, but being,
That's part of the policy and procedure we're developing, is that like, how do we do that? And law enforcement will have to train our staff, and then law enforcement will also have some like basic mental health training as well.
oh,
So
that, yeah.
it'll go both ways. And
Excellent.
we'll have to determine like the extent to which they would have any kind of weapons training. I think that hasn't been determined yet. Does that answer?
Yes.
Anything else on that?
Can I just,
Yeah.
if I can just add a couple of points. Okay,
Turn around.
Yeah, I just left it on.
oh, it's gonna be red.
It will.
Okay, oh, I was just on the whole time. Good thing I wasn't saying anything over here. So I just want to add, I think Doug did a really good job of like sort of summarizing both the conference and sort of where we're at. But just the last meeting that we had in the planning was really around that onboarding and training. And we really flushed a lot of that out. And our next step is to sort of put it into a template or a framework for how long that will take. What was interesting in our discussion is that even though we think that this initial team will be existing staff, the training prior to them being fully trained and ready to go will take anywhere from 8 to 12 weeks. For them to make sure that we're covering all of the components of both mental health and then also the components of law enforcement and safety. So we're learning a lot, I think, in these meetings around things that from both sides of the professional areas of what we need to think about. And I would say for this particular goal, we're needing to still meet with the county executive and find out what the plan is for funding and sustainability for this. And so right now, even though we're still doing the planning, we're in a little bit of a holding pattern until we have some understanding of what the plan will be to fund this, at least to start one team.
Yeah. Thank you, Julie. Interesting. Right. Anything else?
I thought of one other point to add.
Okay.
When Julie was talking about, it, I forgot it.
Okay.
So it really comes to me,
We'll
I won't
walk
go
back
back.
really slowly.
And the last initiative for us was expand substance use disorder services. And that was surrounding our goal to put out an RFP using ARPA dollars to enter into an agreement to have sober living in Washington County for females. So Julie's in the process of writing up that RFP right now, and we hope to put it out in early January.
Remember it? Like,
No, I'll remember as soon as I think about it.
okay, thanks, Doug.
Thank you.
All right, item E, the Human Services of Children and Families Division Quarterly Report, Coral.
Hi, good
Hi,
afternoon.
welcome.
I'm Coral Klein. I'm the division manager for children and families. I have two initiatives to talk about this evening. The first one is improving the quality and consistency of data management and reporting. This one really seeks to streamline data reporting for all of the child and family programs. They're listed on your handout. I won't go through all of them unless you have specific questions around them. There are 7 different areas. 6 of them we can pull out of our state system, our state database called EWIS-SACWIS. And family support is the one where we're doing only specific internal tracking. Streamlining all of the data together in an easy way to report out on, analyze trends. That data for me in partnership, of course, with Julie is to use to inform staffing patterns, service needs, which of course are taken into account when I'm writing grants and doing my state reporting, which I'm doing all the time. Right now that is on track. My leadership team and I have determined 3 to 5 indicators, but it's really closer to 5 because we have a lot of data and we're trying to narrow down what we really want to know and understand about our programs. We began tracking that actually on October 1st, tracking October 1st, then collected, of course, at the beginning of this month, just so we could see if what we were wanting to to track and how to gather if that was going smoothly in order to be ready to start really tracking January 1st and be able to review then on a quarterly basis in 2023 to make sure that we're getting, hopefully, besides the outcomes that we want, that we're actually tracking the information to get us the data that we want to inform our programs. The second initiative is improving the quality of family support services. The family support unit is a new program, or I'd say it's a new program in my division that we started a little bit earlier this year. Right now, it primarily serves Child Protective Services, and the services within family support is really family interaction or supervised visitation when parents need to be supervised with their children, and parent coaching and mentoring. We know that data shows that parenting support earlier in child protection cases leads to quicker reunification and or a reduction in kids entering out-of-home care or foster care, which we of course we hope will look like reduced costs in my out-of-home care budget, which we come back and report, of course, to this group on. And the intent with this initiative is also to review trends over time based on who's receiving services and when. There's really 2 points in time that families would receive services from that unit. The first is in the beginning, an initial assessment when a case first comes in and we're working on the front end. The children may still be in the home during that time, or during ongoing services where usually the children have been removed from the home and we're trying to reunify those children. The state standard is within 12 months. We started looking in October. We've been looking for a while, quite frankly, for service models that are evidence-based, that are going to meet our needs. And we really started digging in October with the intent of having a proposal put together by the end of January 2023 of our top 2 to 3 choices. So we can be talking about those with the leadership team and start the early stages of a resource review and see what's actually feasible and things like that. But we're still really in the early stages of trying to work internally with my leadership team and what types of services and what types of programs would best meet the needs of our families. We have families with little kids, we've got families with older kids, and of course, family issues are very complex. So we're trying to do the best we can to be most efficient in providing those services. That's all that I have. Any questions?
Comments? Squirrel.
Thank you.
Item F, our last item is Human Services Economic Support Division. Renee?
Good evening. Renee Zagel, Economic Support Manager. I have 2 initiatives that I'll be reporting on tonight. The first one is the hybrid work from home model. We started this back in March. We had received the ARPA funds that were they're very earmarked on what it can be spent on. So technology was a big one there. I think there was only 3 items, and technology was one of them. And we decided we would use these funds to capture all of the technology things that we needed, laptops, docking stations, all of that, so we could retain the knowledge of staff that we have. The other consortiums, counties in our consortium, there's 4 others, all of them had already been working some sort of a hybrid model. So if they're working from home and we were afraid we were going to lose staff. So we went and did all the development and implementation, the policies, procedures, had those all written up and addressed to staff, and staff signed off on them. We ordered 2 laptops and tested with everyone at home, because we also have the call center. We wanted to make sure the call centers were working from home, which we did successfully. So we modified office space. We were able to make our footprint a little bit smaller in economic support, because we are now office sharing, kind of hoteling. So everyone has an office mate, so it's a rotating schedule. Might be in the office 3 days and then home for 3 days, and then rotates with staff. It's worked out
really well. We also have all the measurement tools that we can see what everyone's doing at home. The state system cares, we're able to see all the keystrokes, what time, if there's a lapse in time, we can question what was going on during that time. Our call center, we're able to listen to every call that's being, every call is recorded, so we can listen to any call, make sure that things are going the way we want them to be going, as if they were working in the office.
So, sounds like, it's pretty. Authorish. They're keeping a pretty solid eye on things, which, for our purposes, is probably a good thing, but, is that received okay by the employee?
Well, and if there's certain things, if we're seeing patterns, we're addressing. But we're not listening every day to that's so time consuming, but we do spot check and the staff know it. And, they knew that once you're home, we are also can listen to them when they're in the office as well. So I think they knew that was the expectation. And, productivity has to stay up at a high level that we're at. It's kind of common knowledge that when people start to work from home, sometimes the productivity goes down. So that was one of the majority of the staff were very excited. There were a couple that, because of technology, they were a little afraid that it wouldn't work well, but everybody now is pretty happy about it.
I just, my concern is always morale of the staff. You want to make sure that the people, and I have it, I drive truck and there's a camera right there watching me drive and watching how, they know exactly how fast I'm going and every metric of my truck, what's going on. So, and a lot of my fellow drivers are really put off by that, and I was at first as well. But if you handle it correctly.
Right, and for some, it's just a learning tool. We should maybe do this way instead. If it's a problem, if we're seeing some sort of productivity, why maybe you should do it this way instead of this way. But the staff has been very receptive of. And everything's been on track. We just staff went home as of August. We started the rotation August 8th. Yes, August 8th, I believe, is the day that we started doing the hybrid model. The second one is the implementation of the Birth to 3 childcare program. Now, this is different than childcare subsidy because this is for children and families that are in the Birth to 3 program, that they do not have to have any sort of an work component to get childcare or an income component to receive the childcare. This is Department of Children and Families. This is also using ARPA funds and is for families that have a child enrolled in Birth to 3 and more like a respite for childcare or help those families pay for their childcare. We don't do any of the eligibility because there is no eligibility of it, but we have coordinated with Birth to 3 and met with them prior to, we started October 1st, and they will send us electronically families that are interested in receiving the childcare, and then we write the authorizations. We received funding to write 42 authorizations. So far, we have referred 16 families and 8 authorizations were written in the month of October. So we had received the funding for through this year was 42, and then we also received funding for another 42 next year. And then this will expire June of 2024.
There a continuation?
At this time, no.
Is that via
Because
grant?
of the grant, ARPA grant.
Oh, that was our.
Mhm.
Okay.
Yeah, and then we are reimbursed by how many authorizations. But if we aren't getting the referrals, and we've got some referrals that we weren't able to write an authorization because the families are maybe at a childcare provider that does not isn't certified, you know, state licensed or that sort of thing. So. Any questions? Okay. Thank
Very
you.
much, Renee. Right, so that ends the discussion items. Our next meeting date is January 25th. We won't be meeting in December, so, that should do it. Our meeting is adjourned.